Hi doctors! I'm 7 months pregnant and this is my very first child. I try to take care of myself and eat well and all that. And I was wondering, are there any tests that are specific to being pregnant that I should be getting, and if so, what are they? Thanks, doctors.
Oh, she's great. Darlene is here with us today, and she is just beautifully pregnant. Look at that.
Thank you.
Darlene, one of the most important tests that you can get during pregnancy is the oral glucose tolerance test. And you usually get that about 24 to 28 weeks. How far along are you?
I'm 28 weeks.
So you definitely have time to get it, and you got it, didn't you?
Yes.
And we have your results, but before I give you your results, we like to make you wait a little bit on this show. Before I give you the results, I'm gonna explain to everybody why this test is so important and what happens in the body. So we're gonna go here, and here we have a lady who's not pregnant yet, and I'm gonna magically make her pregnant here. That's the first time I've ever done that. Really happened fast. And basically, when she's 24 to 28 weeks, so this is a uterus that's about that size with the baby inside, you have the placenta. Now, you have to think of the placenta as sort of a two-way refrigerator. Mom puts the food in, and she makes it all healthy, and it goes to baby, so baby gets all these nutrients. And the way that happens is there's actually hormones in the placenta right here that help that break down and help to really maximize the efforts for the baby. And one of these things is something called human placental lactogen, which actually causes insulin resistance. And I'll show you why it's important. But first, let's find out what normally happens with insulin. Basically, the insulin is produced from your pancreas, and what the insulin does is it attaches, it basically gets the sugar, this is sugar, and it breaks down the sugar so it goes into cells and doesn't stay in your blood so that your body can use that for nutrition. But what happens in pregnancy is pregnancy causes an insulin resistance because what it wants to do is maximize the sugar that's in the blood so that it goes more to the baby. So you can see here an insulin resistance happens so those little cells can't get onto the sugar and break them down so that there's more for baby. You would think that would be a great thing. It'd be like putting stuff in your refrigerator and it gets 3 times better. But what actually happens is it can make this baby grow huge, and we call that macrosomia. The problem with macrosomia is it can cause increased surgeries like vacuum delivery, C-sections. It can actually cause stillbirth. It can cause preterm labor and preeclampsia. So it has a lot of risks associated with it. So this is why this is such an important test for a woman between 24 to 28 weeks. And Darlene got that very, very important test, and I know you're dying for the results. Do you have any questions, though, first?
Yes, on both sides of my family, diabetes does run. We have a history of it. Do I have a higher risk of it? Should I be more concerned about it?
It does run in families, and when it does happen, it can increase your risk during pregnancy. And a lot of times, I'll actually check a woman's glucose or sugar before she gets pregnant, because that's the most important time a woman can do that, is before she gets pregnant, because if you have abnormal sugar before pregnancy, it can cause birth defects and miscarriages. So we do sometimes screen you beforehand, but that's even more reason why, you definitely need to take that.
Okay.
Now, are you ready for your
Yes.
results? Boy, we sure strung that out. Basically, your results, I have them here. They were normal. You got a 111, which is beautiful. You want anything below 130, okay? Anything below 130, you did fabulous. If it was abnormal, then you actually take another test, which is a 3-hour glucose test, and then you go from there. But it all comes down to decreasing your risk by diet and lifestyle, which is most of how we deal with diabetes. So a lot of times we start with tweaking your diet a little bit, getting you to exercise, and if that doesn't work and your sugars are still high, then there's medications. But the thing to do is follow it with your doctor, have a doctor who can really follow pregnancies that are, involved with diabetes.
From the baby's point of view, this is so important to get this figured out, because one of the worst things for a baby, a newborn baby, is undiagnosed maternal diabetes, because it makes the baby grow too big. It can affect their heart. It can make their blood sugar just crash, which can cause seizures. It can be really bad stuff if it's not found.
If it's not found, and also when we do find it, we actually tell the pediatricians, because they have to do special tests on the baby to make sure the sugar doesn't drop and things like that, because they're not equipped to handle all those changes. So huge, huge, huge test for women.
Thank you.